Thanks for staying with us. According to the chairman of the Nigerian Medical Association, NMA, FCT chapter, NMA Amodu, at least 20 Nigerian doctors died from complications arising from the coronavirus in the last 1 week. He said the deceased health workers include consultants, professors, and some resident doctors. On the show today, we'll be discussing the battle against COVID-19 pandemic in Nigeria. You can join the conversation by sending us a tweet on TVC Connect. Please hashtag your TVC so we can read your tweets. We have with us Professor. Good morning, sir. Are you there?
Yes, I am.
Chairman.
Good morning.
Good morning, sir. It's good to have you on the show this morning, sir.
Thank you. Happy New Year to you.
Yes. So we have with us the President, Nigerian Medical Association, Professor Innocent Ujah, joining us to discuss this segment. Sir, so according to reports, 20 doctors have died, obviously, as a result of COVID-19. And we read in the papers yesterday that the Nigerian Medical Association will be doing everything it can to get the PTF and the Ministry of Health to support in training doctors to help them get safer and managing the virus. How far is this gone, and what are you doing to ensure this is done quickly?
Well, thank you very much. It is sad that the second wave has come. It's also sad that even at the beginning, and perhaps still now, not many Nigerians believe that there is COVID. And therefore, they are not complying with the NCDC protocol of hand washing and use of sanitizers, use of face masks, and social distancing. And now we've come to this stage, and this stage appears to be deadly. Many more people are dying, including some of our colleagues who are paying supreme price for giving service to the nation. As to training, of course, training and retraining is a part and parcel of the calling of the doctor. And we train regularly, we retrain regularly, build our capacity, particularly to the emerging and re-emerging diseases, now COVID-19 pandemic that has come. We find that we need to do a lot of training for health workers, not just for doctors, in areas of infection prevention and control. That we have the commitment. However, we need support from government, and in this case, Federal Ministry of Health and also the PTF. As you know, PTF is in charge of the containment of the national response of COVID-19. And we need to work with them, or they need to work with us, so that we can work together and reduce the ravaging pandemic of COVID-19.
Okay.
In doing so, we need to continue to train, and we need financial support. We need to get people are ready for training. However, this can't be done now until after the holidays, and New Year is coming. As soon as the New Year is over, we will then meet with them and discuss with them.
All right, sir. I know that during the first phase of the COVID-19, we had issues of inadequate PPEs being distributed to the hospitals. How equipped are we now? Is there progress in that regard? Do we have enough?
Well, how far have we gone? Do we have enough? The issue is that we will never have enough. But what we are saying is that we should regularly have the infection prevention materials, i.e. the PPEs. And the government has improved on what they were doing, and we expect that they sustain it. We still need more of the PPEs as long as we are battling with COVID-19, because we don't know how far we can go. We don't know what else will come. And the most important component of this response is the preparedness. We have to plan, we have to prepare, and then we respond. And we believe that working with government and other stakeholders, we should be able to contain the disease, but we do not know the extent. to say that we have enough, we can never have enough. As you know, there was one time when there was an error of statement or maybe misrepresentation that Nigeria has enough doctors. There's nowhere in the world that a country has enough doctors. So we do not have enough doctors.
Okay.
We do not have enough PPEs. But we expect that the government will continually supply these PPEs so that we reduce the risks and hazards of the health workers, the doctors and the nurses.
Okay, let me get a few more questions.
Okay, sir. You said that the government, they've been doing a lot. And I wanted to know if it included, because even if we can't provide enough PPEs, we should be able to provide enough insurance, health insurance or life insurance for the doctors on the front lines. Do they have health insurance, life insurance, or work as something like that for the doctors, so that we can be sure that those that have died, their families are well cared for, or those that are working will be motivated to keep fighting?
Well, you are right. It's not the issue of life insurance has been on for some time. We are told that the process is on, but we, at the moment, doctors and other health workers who should have life insurance do not have the life insurance cover, and that is something that we will have to continue to pursue. We started it at the beginning of the pandemic. We were sure that we would get the insurance, the life insurance, but that is far from coming. The second is the issue of the hazard allowance. The government paid hazard allowance for 3 months and stopped and say we will evaluate it in the hope that they thought that pandemic will go within 3 months. You and I have seen that pandemic is not only going, but it's getting worse with the new strain and then the new pathologies, the fatalities that we are recording. So obviously we need to review with government this, because the hazards, the risks of facing this pandemic is so much, and it's only good and well if the government will respond appropriately by interfacing with the doctors and the nurses who are at the front line to ensure that they are motivated. This is a time for motivation. We do not want this incentive. We don't want our doctors to be demotivated. And one way of motivating them is to ensure that life insurance cover is provided, and hazard allowance that is paltry at the moment, 5,000 naira per month, should be improved upon. And we have to negotiate this so that there is no allowance that can buy a human being. Once you die, you die. But you see, when you are working, you should be motivated, and that is part of motivational strategy for people to know that, well, they are being supported, their services are being valued, and therefore they show more commitment and dedication to their duty.
Let me go on a quick break. When we come back, we'll continue this conversation with Professor Ujah. Stay with us, we'll be right back. Thanks for staying with us. We have with us Professor Innocent Ujah, who's the President, Nigerian Medical Association. Sir, are you still there?
Yes, I am.
Okay.
Thank you.
Okay, go ahead.
Yeah, I was going to ask, you said you're going to check, see about it after the holidays. And I'm wondering, isn't that too much time passed? Because the holidays are like 2 weeks. And every day, more doctors are getting infected. Every day, their hazard allowance is not being attended to. I'm wondering, isn't it something you should do now? And then another thing is, you said the government is...
You know, it's very easy to say we should do now. If you go to the office, who will you see? Yesterday was public holiday. People are just coming in today. Today is Tuesday. We will be discussing with them. I don't want to be moving from office to office. I want to move to office where I can see people to discuss with. And it is not 2 weeks. When I say holidays, I said New Year. New Year is when? New Year is on Friday. By Monday, it is possible that we can interface with them. However, you also know that whatever we are discussing, they are aware. I mean, I've had some private discussions with some of the ministers, and all we need to do is to have people with whom we discuss. And it's not just the minister, you know, they have directors and the officers in charge. So we will do the best we can. Meanwhile, we urge our colleagues, doctors, to ensure that they treat every case they see in the hospital or anywhere as a case of COVID-19. In that case, they must necessarily protect themselves using the infection prevention protocol. And in that case, minimal number of our colleagues would be infected, and minimal. We don't even want any one of them to die at all in providing service.
Okay.
Yeah, please, that brings me to my next question, which is, you said the government was doing a lot, but my own personal opinion is the people are not being sensitized.
I didn't say the government was doing a lot. I said the government was responding to our request. I didn't say the government was doing a lot. In any case, whatever the circumstance, you know that this is some prepare.
I was actually asking about sensitization.
Said what?
I was asking about sensitization because right now you are talking to the doctors to treat every case they see as COVID. I'm actually talking about sensitization because I feel that if government sensitizes people more, people will take the disease more seriously. And that's what has been happening from day one. Like, I think every single corner you go to, there should be information, there should be advertisement, because information is key.
Okay.
Yes, I agree with you completely. And that's what the media is doing as part of their own contribution to the national response. Secondly, I've also said that the National Orientation Agency should up its game to continue to inform and educate people, and also to sensitize people, create awareness. And this can be done in several ways, through a traditional form of communication, i.e. using town criers, using the traditional rulers, or town hall meetings, and all forms of strategy they can use to pass information, educate people, and answer questions on those who probably do not even believe that COVID-19 is real. So what I'm saying in effect is that the National Orientation Agency should improve their information and communication system so that they can continue to educate Nigerians. That is the doctors' information process is very limited. It's limited to the patients. And we have an organ in Nigeria, that is the National Orientation Agency, that would be sensitize, educate, and inform the public, while the media is doing its own. The radio, the TVs, and the rest should continue to give information in various languages to the people.
Professor Ujah, one of my greatest concerns is the seemingly, I'm trying to use the right word here, kids' gloves approach to this issue of COVID-19 in some ways. Because as the president of the Nigerian Medical Association, is there some kind of data that you and the doctors are gathering concerning what is happening right now, the trend we're seeing, what the patients are going through, what the doctors are going through? Do we have, are all hands on deck to support the federal government with data? Because your doctors, your organization, your association, they have the direct link with the patients. So what information are you sharing with the federal government? What information are you sharing with other doctors? Is there, what new trends are you seeing that can help us understand how to combat this better? Because many around the world, we've seen how all hands are on deck to see how much information they can get from the universities, from the government, from the scientists. What's happening in Nigeria? It's almost as though all we're waiting for is just for the PTF to give a press briefing. We don't have any other source for information. So what data are you gathering as an association to support?
Let me tell you that if you do not know, part of the functions of PTF is to gather information through research. It should have a research component. The data collected by individual doctors are the properties of the hospital, and they are used in their hospitals. But the public health information using the public health data should come from the section of PTF, which is a research section. And by now, we would have gathered a lot of information from the field, and that is the responsibility of PTF and the Federal Ministry of Health. The Nigerian Medical Association has manpower to do that, but they don't have funds. So once they contact the NMA and say, look, we need this number of people to support us to carry out this research, we will willingly oblige, because we are committed to the national response. We are committed to the eradication or to the containment of COVID. But the...
Okay, we're having some technical issues. That's going to quickly. When we come back, we'll continue with the conversation. Stay with us. We'll be right back. Thanks for staying with us. We still have our guest with us. Nima had a question for the break.
So before Corona, sir, are you there? Before Corona, we had other things killing Nigerians. We had Lassa fever, we have every other thing killing Nigerians. But we had our doctors, when they were trained on protection of infectious diseases, to protect themselves and, leave patients to themselves as well. So people started falling down, dying, not necessarily Corona, but because they couldn't see their doctors continue their treatments in the hospitals. And now the NMA is proposing training doctors on how to prevent infections while at work. Does it include, how to diagnose other illnesses so that people can also seek treatment for those illnesses, or totally just protect yourself and tell the person, be asking questions while they stay from a distance? What exactly does the protection against infectious disease training for doctors include?
Well, unfortunately, you will not understand when we put this thing that looks very simplistic. Infection prevention and control is a whole discipline of itself. It's not about diagnosing. It is about ensuring that you protect yourself and protect your patient. When you are seeing your patient, there are modalities of doing that, what you should do, what you should not do, to ensure that the patient is protected from infection. You hear, we will say infection prevention and control. It's not about...
Okay. It's frozen right now, but we'll still try to get him reconnected.
And we can discuss amongst ourselves now.
Yeah.
Because from the way I see it, I don't think that Nigerians really believe in this disease.
And I think that is what it means. It's not about making a new diagnosis for a new disease. No, this is purely a discipline for which we have to protect ourselves and protect our patients too, because you'll be surprised that the doctor may have catarrh, and if he does not protect himself or herself, the patient who is before him or her will contract the disease. So in doing so, and in a circumstance of COVID, we do not want doctors to contract the disease. And because we don't want them to contract the disease, they need to be trained how to handle a patient when the patient comes to see him or her. And that is what we talk about when we talk about infection prevention and control.
All right, Professor, I know that one of the responsibilities of the Nigerian Medical Association is giving unsolicited recommendations to the government so that we can all improve the health sector. Now, I would like to ask you, what are some of the recommendations that you have given in the past year, looking at how our health sector over the years have deteriorated?
Well, let me just say on this, the NMA has done very well. You recall that we have said several times that the health system in Nigeria has collapsed, and we need to resuscitate it. We have said that doctors are leaving this country in large numbers because of very unfavorable operating environment. We have also said during the during the
COVID.
When the first case of COVID-19 was discovered, we say we should close our borders. We said so. We have said everything that we needed to do. We said they should provide personal protection equipment, PPE. We say that people should be trained and retrained. We say that information dissemination should be, at the highest. We have said everything that needed to be said at every time. We said they should provide life insurance to health workers, not just doctors. We have also said that the hazard allowance of 5,000 naira is not only shameful, but it should not be talked about at all, particularly at the time of COVID. Yeah. We are saying that the doctors and health workers should be motivated. Right? So how else can we do this? We say that if they need if the services are required in areas of research or anything apart from regular containment, we have deployed people to the front line and to isolation centers. I don't think anybody can fault the doctors on this, because at every stage we have brought our knowledge, brought our experience, we have brought our expertise to bear on the health system of Nigeria. And all that needs to be done is that the powers that be, the policymakers must listen to the experts. They must listen to the doctors.
Okay.
They are trained in this. They have the knowledge. They have the competencies. They have the experience.
All right. Go ahead.
So what was the stand of the NMA when the government across board, all states governments started closing isolation centers within their states? Was it not, lack of foresight when they did not prepare or when they closed these places, with the recent spike that we have?
Again, you know that the NMA can advise, NMA can caution, NMA has no power of enforcement.
That's the problem.
The NMA has no power of enforcement. All we can do is to give advice, is to caution. You recall that when students were asked to, the schools were asked to reopen, we said they can reopen, but provided they are prepared. And what is the preparedness? I.e., we must ensure that we obey and comply with the NCDC protocol. But you saw what happened at the NYSC camp. You now have records of the number of people that have contracted the COVID, because of the fact that probably they do not want to, or they are unwilling to listen to the experts. Doctors have predicted this. You see, there is epidemiological characterization of every disease, and we are trained in this. And we only say that the government and stakeholders should listen to us, because we are trained. We don't go to the marketplaces to make noise. We are trained and we give our advice, in fact, unsolicited.
Professor,
These days, no advice should be given free of charge. But we give our own advice free of charge because of our calling.
Professor,
and we believe that
I understand
we should be listened to.
Professor, we understand that very clearly. Giving advice or showing, expressing your professional viewpoints in issues like this is important. However, we Nigerians are used to people giving advice, discussing, giving recommendations. Our issue is not about your advice. Our issue is the implementation. Who do we hold responsible for not implementing? Who is the government? Who is the person in charge? Because the truth is that we know the right things. We have the laws, but nobody's implementing.
Yes, I'm sure you know the answer. That's why I say that the doctors have no power of enforcement. We don't have power of enforcement. All we can do is to give the advice, to caution, is to give our services when our services are needed. There is a government in place that is, we have Federal Ministry of Health, and for this particular condition, pandemic, we have presidential task
Okay,
force.
let me ask your recommendation.
And that's the highest level of the response.
Let me seek your professional counsel in this regard. So we've had a whole year of the pandemic, and obviously it has brought to bear the fact that our health system is in serious state of decadence and we need a revival. What are your recommendations to the government at this point going forward? Because we've learned quite a bit about how much work and investment we need in the health sector. What are the notable things you think you have recommended so far to the government to improve this sector, to avoid brain drain, to increase research for our universities in the medical sector, and other things as required in this? What have you done so far, sir?
Well, that we have done, we have documented. The truth of the matter is that, like you said, sorry. Hello, are you hearing me?
Yes, very clearly, sir.
Are you?
Yes.
Okay, fine. Now, what we have done is to give our advice in a memo form. But the truth of the matter is that for the public, we have done all that we needed to do. For one, we have now seen that COVID has exposed our nakedness to the weakness of the health system of this country. And we are very lucky, in fact, that what is happening in Europe and America has not come to Nigeria. If it had come to Nigeria, probably all of us would have gone. Because the number of deaths, is not as severe as that of Europe and America. But we don't want anybody to die as a result of this disease. So we've done the bit we can do. We have said, we see the truth of the matter is that when we say close our borders, nobody listens to us. So the reality is that if we must be documenting and learn and use the experience for the future, because the truth of the matter is that if we don't plan, we are not likely to succeed. Yes. We have learned some experience from, and I'm happy that the Secretary to the Government of the Federation had said that he didn't know that this is how bad the health system had been in Nigeria. So obviously, an officer of government, very senior officer of government, making that statement in terms of advocacy, I believe that that is something that is positive for the health system. All we need to do is to sit down, get people of credible knowledge and experience, not anybody anyhow, or family and friends, to come and look at this health system. You need to put the government will need to put a crack team that will honestly work out what we should be doing from now. Because the way it is that if we continue this way, it will not be good for Nigeria.
All right.
So many of the recommendations that we have to make, we continue to make, because it's our country and we have to have commitment to the prevention, promotion of health in Nigeria.
All right, thank you very much, sir. It's been a great pleasure having you on the show. Sir. Thank you for shedding light on this. We'll be speaking with the President of Nigerian Medical Association.
Thank you very much, and
Professor Innocent Ujah.
Thank you very much for the good work you are doing. You need to propagate the information and disseminate the findings to the public so that they can comply.
All right, sir. Thank you, sir. Let's take a few tweets, guys.
So Mr. Adebayo is blowing hot here. He says infection control is a big thing in the UK healthcare system. We lack those structure in Nigeria. We lack the investment and the will to establish such to reduce the infection rates in Nigeria hospitals. I'm surely writing my project on it. He also says providing healthcare should never be a source for negotiations. Subsequent governments have neglected this sector, and the present are not helping the situation. Health is wealth. Until we know that, we will always revolve in a cycle.
Gabriel says, where can you go?
Festus Akimbo Yewa says, majority of Nigerians and some governors are not taking COVID-19 seriously. Our journalists should please go to the hospitals and report what is happening there. It will wake up the state governors and Nigerians. Gabriel, it is quite disheartening that up till now nothing has been done for the families of those doctors who lost their lives, not to talk of making adequate provisions for the doctors and nurses who are on the front line.
Mr. Adebayo again says they are building railways and leaving out the health sector. Who will drive those trains when every staff is sick and have the potential to spread the disease? My country have so many clueless people in decision-making realm. Wrong priority.
Mutaza Miki Yusuf says, news of the death of 20 doctors in our battle against COVID-19 is unacceptable. Lack of personal protective equipment was a major factor that could have led to the death of our precious frontliners. NCDC must take the government to task on doctors' welfare. And Moses says, sincerity from the government and Nigerian doctors, including the entire citizens, both at home and abroad, is the only way COVID-19 will be defeated. Take responsibility.
See, I don't know.
I did a little research this morning, just before the show, because I wanted to really find out the functions of the NMA, because I know that they have been making noise. Now, it's been brought to the fore that they do not have powers beyond recommendations. So the job now is for those people who receive the recommendations to go ahead and implement. And it's obvious that we do not have the willpower from them to implement, because they don't feel the pains of Nigerians. They don't use the same hospitals that we use.
You need to understand what when you are in government. You see all the health commissioners that are in government now, they were probably in NMA. making the same noise, making the same noise this man is making.
Yes.
Okay.
When you get there, it's a different ball game.
And the different ballgame, YK, I think, is also other economic factors. So, if you're an NMA by yourself, your mind is shut the borders. But if you are in government, you understand that shutting the borders is not just a decision as a doctor. You now have to consider the economic factors. You have to consider other trade factors. There are many things to be considered. So maybe that's why if they're not implemented. But my own worry is, I think we are missing data. We need information. You know, when you speak to experts or presidents of organizations like this around the world, they're telling you X percentage of people have died, X percentage of PPE we have, this amount of this amount of information is how much they need. You know, there's something, you feel that they have the information at their fingertips. Here we are just going around. It's almost like we don't have enough data to know exactly what are the real next steps.
That was the question I wanted to ask him. I wanted to ask him, and that was, do you think? Because what I suspect is a lot of people who have got it, have gotten it, have recovered without even doing tests.
Nobody knows.
Nobody knows. If you tell me that I should go and do a test for 50,000, I realize sit down in my house and drink and go and get better or die off. Than go and use 50,000. That's not treatment to just test. Yes. Now, I know of Nima's experience at the testing center. If I hear of that, I'm not going to want to go and subject myself to that kind of. So there are so many factors. That's why there's a school of thought that believes that, come, tell people what to do, so that if we fall in, we know what to do.
Give us the
treatment. Give us, you know,
how to treat ourselves at home.
So that we don't start dropping dead on
we have to run,
I know we have to run.
The state commissioner
we have to run.
There's somebody who has been abusing us here. Like we did not say happy birthday to his wife. His wife was yesterday two London people. So his name is Obon Lawrence Osezua. Osezua. And his wife is Helen Obo. Please, happy birthday, Helen.
Happy birthday,
Very beautiful.
Very beautiful.
All right,
but the state commissioner, the state commissioner we're talking about during the first topic was the commissioner for education in Akwa Ibom, not Cross River State.
Oh, yes, you wanted to
so we cannot close without correcting.
Okay, fantastic. All right, that's all we can take. Have a fabulous day. We'll see you tomorrow. Bye for now.